Do that. I'll send that.
All right.
Okay, let's admit people, please. Okay.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.
Hello, good morning. It's another lovely Saturday, and it's my pleasure to be hosting this CAHN Health Hour session. And my name is Dr. Diana Asante. I'm a general practitioner, and your regular host for the CAHN Health Hour sessions. It's always a pleasure to see you wherever you're joining us from, whether it be on Zoom or on Facebook or YouTube, wherever you're engaging with us from, and we really appreciate your time and your input. We always have something interesting to bring to you, topics that would empower us, that educate us and help us to be better equipped to manage our health. And we also thank our Black clinicians, doctors, consultants who give their time week in, week out to come and educate us and give us information. So once again, welcome to the CAHN Health Hour session. And CAHN is run by CAHN and its partners, so CAHN being the Caribbean and African Health Network. We've got the BHI, which is the Black Health Initiative, and we've got Croydon BME Forum, Enfield Caribbean Association, Rafa International Development Agency, and the Royal House Redeemed Church of God in Sheffield. So it's my pleasure today to introduce the topic. We'll be talking about hypertension. Hypertension, a topic that is probably dear to everybody's heart. We all know something about hypertension. We've all probably at some point had our blood pressure monitored, or we know someone who suffered from complications of hypertension. So a very important topic, because it can affect all parts of the body, different organs. It can have important complications. In the last few weeks and months, we've been talking about other things like strokes, mini strokes, and we know that hypertension is also a risk factor for several other conditions, serious conditions. So it's my pleasure to introduce the resource person for today, who's a very familiar face on CAHN. He's always with us. He's very knowledgeable, he's very experienced, and he's always willing at the drop of a hat to come and educate us and to equip us. He's been with CAHN right from the beginning. And he's no other than an emergency consultant, emergency medicine consultant, a very experienced doctor with years and years and years under his belt, and also a very affable person who will break things down right to our level. So Dr. Kamara is our host for today, a very familiar face to people who would be on the CAHN Health Hour usually. Now, today's session as well, people do have the opportunity to win a blood pressure machine. So we've got one blood pressure machine, which we're giving away. And I will ask Ngozi to tell us how people can participate and go about being able to win that blood pressure machine. This is just something small to incentivize us and to help us. But Ngozi, I'll hand over to you to tell us how we can go about that. And then we'll have Dr. Kamara, our consultant for today, take us through the topic of hypertension. Welcome once again.
Thank you, Dr. Diana. Good morning, everyone. It's nice to see you all today. So I'll just quickly run through how you can win the blood pressure monitor today. So at some point, we're going to ask 2 questions. So please listen attentively. 2 questions, and then if you need to answer those 2 questions correctly, and once you do that, you can put your answer in the chat box with your email address. But if you're not able to do that, you can send a text message to this number. So we'll put all of that in the chat box for you still. A text message to 07493849910. I'll put that in the chat box. And you need to do that by at the latest 12:15. So the questions will be asked before then, and that will give you a chance to win that. And then a draw will be taken and winners will be announced during next week's Health Hour session. So over to you, and happy listening. Thank you.
Thank you. Over to you, Dr. Kamara. Thank you for joining us.
Yes.
We appreciate it.
Good morning, everyone. And thank you for having me. We are talking about a very important topic, but I wondered whether the audience will, sort of humor me by just taking part in this small exercise just to get people going, really. It's a Saturday morning, everybody wants to go out and all that, but I think it's vitally important to listen to something that'll help us, manage our health better. Because as I say, you only have one life. You don't have another as a spare when one goes down and the other one is sort of used. It's one, and therefore it's important to look after it. And that's why it's important to do this. So I wondered whether, if you can see this slide, it's a very busy slide, but I wondered whether the audience would be able to partake. And as I said, it's just a small exercise. You look at the slide, and the first word that comes to your eyes or to your view or whatever you can see first, just bring it out or say it out. And then, of course, I am looking for a particular word, but that word relates to why we're doing these talks. So whoever is the first to notice it, that's fine. That person probably would know my mindset in terms of why we're doing it. But here we go. So the first word that you can see, by all means, please bring it out, and I'll try and match it with an answer to why this particular word is in this slide. So over to you. Whatever word you can come up with. And once we get to it, I'll say, yes, that's the word. So here we go. Anybody? The first one?
Heart.
Heart, right. Yeah, the heart is good. That's what we all have. And it's important to remember that the heart is one thing that controls the blood pressure. Anybody else?
Salt.
Salt, brilliant. Yeah, that's one thing we need to cut down on. So if you've been told you've got a high blood pressure, then salt is something you want to take care of, i.e., because the kidneys do not, process the salt well, and so therefore you need to cut it down. Otherwise, the pressure will go up. Anybody else?
Genetics.
Genetics, brilliant. I like that. That's very good. This is something you can't do much about, but you can do something else about the other thing. So genetics, where you're born, the family and all that, that's something you can't do much about. But there are things you can do about the other factors that are not genetic. Good. Anything else?
Women.
Women, that's right. Well, women are less prone to high blood pressure in comparison to men.
Obesity.
But as they grow older, they get to the menopause, the blood pressure risk becomes the same. So yeah, what was the other one? Say?
Obesity.
Obesity, that's it. So that's one thing we need to control. We need to cut down on the, somebody said genetics. Now, genetics you can't do much about, but obesity you can do something about. Definitely try and cut down on the weight by doing more exercise, you know, by being mobile, and obviously by watching the portions that we eat, and of course making sure that the amount we take in and the amount we burn is definitely more than what we take in. Anybody else?
Pressure.
Sorry?
Pressure.
Yeah, pressure, that's right. But pressure, that's something to do with the fact that the blood forces the heart forces the blood out of the blood vessel, and because of that you generate a blood pressure. So the force that it uses is what increases the blood pressure. If it's less, it's a low one. If it's high, then it's a high blood pressure.
Rapid heartbeat.
Rapid heartbeat, right. So the rapid heartbeat can happen to anybody. If you see something you don't like, the heart rate goes up. If you actually are asleep, the heart rate goes down. But the blood pressure can actually be sort of gauged by the heart rate.
Control.
Sorry?
Control.
Control, brilliant, that's it. So the blood pressure is controlled, as I say, by a mechanism in the body, but then many a time you don't get to actually control it yourself. The body controls it, but sometimes it might not be controlled and you don't know it at all. And that is why the blood pressure is called a silent killer, because it can catch you, and the first thing you present with is probably a heart attack or a stroke.
There's some comments in the chat box as well, Dr. Kamara.
I won't be able to see that, but if you can read them out for me, I can definitely.
Yeah, so some people have put stroke, someone has put control, someone has put weight, heredity, risk, men are some of the answers that we've got in the chat box. Diet.
Diet, right, yeah.
Diet.
The only thing we haven't touched on is the diet of all the other ones that you've just named. Yeah, diet, obviously, as I said, I talked on the portions, you know, the kind of food. If we eat more carbs, we're prone to diabetes and things like that. We need to eat more of plant protein rather than animal protein, you know, which is important for us going older, because the cholesterol goes up and it goes hand in hand with the blood pressure and of course the diabetes, which is a dangerous combination. Anybody else?
Medication.
Sorry?
Medication.
Medication, yes. As I say, some people don't know they have this blood pressure. As I say, about 14 million people know it, but 5 million people are undiagnosed. And so obviously when you are diagnosed, there's certain things you can try. You know, you can try that, and then of course that might help. But if that doesn't help, then it's important to medicate you to bring the blood pressure down so that it's actually safe for you. And of course, you need to maintain that going forward. So the arteries, yeah. Arteries, as I say, yeah, these are the blood vessels we need to actually pump blood to all the parts of the body. And that is where the tension rises from, you know. So we'll talk about that as we go on, yeah. Anybody else?
Hyson says stress, and some says comorbidity in the chat box.
Comorbidities, yes. As we grow older, the population ages, and as a result, you have all the problems added to the ones we have already. The ones we don't know about and the ones we find out about are what we call comorbidities. Yeah. What was the other one? Sorry.
Stress.
Stress. That's it. That is one main factor in actually why the blood pressure goes up. You know, when you're asleep, the stress level is less, and so obviously the blood pressure should be lowest when you're asleep. You know, at night. When you wake up, that's when the blood pressure starts going up, and it actually peaks around midday. So it's important to know that. But of course, stress is one thing, especially the negative stress is one thing you need to avoid as best you can. We all work in stressful jobs and things like that, but you don't want to make that becomes a habit and, you know, sort of stresses you to the point where the blood pressure goes up and then you end up with a stroke or a heart attack. Yes. Anything else?
40 over 100.
Sorry, 40 or 100. Yeah, that's just giving you a blood pressure that is probably the one that you need to keep an eye on, because if it gets to that point, then you probably get the GP to say we need to monitor that as best we can by doing some lifestyle changes and all that in order to bring it down, you know.
Anxiety.
Anxiety, yeah, that's related to stress. Yeah, the more anxious you are and the more stressful you are, the higher the blood pressure and the likelihood of you getting a complication. Anything else?
Val says cholesterol.
Cholesterol, yeah, I've just said it. We talked about it. So if we eat more of plant protein rather than animal protein, we definitely will get better, because we as animals, we are human beings, we produce our own cholesterol. And so if you put more cholesterol to it as the years go by, you definitely would have a raised cholesterol. And there's a dangerous one, which you don't want. And then there's a good one, which you need. So if the good one that you need is there, it would help you. The one that you don't need, which is a bad one, definitely would cause you a bit of problem. It causes the narrowing of the blood vessels, and so therefore the blood will not flow through smoothly. And as a result, you get angina, and angina can lead to a heart attack. Nobody has got my word. Oh boy, I must have created an issue here. Why are we doing these talks? Can you see the word?
Awareness.
Awareness, brilliant. Where did you say?
Hypotension.
Prevention, brilliant. Who said that? Brilliant. You deserve an applause. That's good. That's it. We're creating awareness. We're sensitizing our people because we are more prone to this thing than compared to other people. I'm glad we did that. So I hope you enjoyed that. Yeah. So here we go.
And just to chip in, there are actually 5 blood pressure monitors going. 5. So your participation is so good that the powers that be have increased it to 5. So please, let's all listen attentively, participate, and enjoy it. Thank you, Dr. Kamara. Please carry on.
Brilliant. That's right. So as I said, I think I've said that already in that, and I'm glad at least we did that exercise, because all the answers you've got and the talk is based on the answers you've just given. So blood pressure, I always like defining whatever I'm talking about. So what's blood pressure? It's the force that the heart uses to pump the blood around your body. Yeah. So that force which the heart uses is what is called the blood pressure. And the blood pressure is measured on, on the arm. Some people prefer the right or the left, but we'll talk about that because there's a question somebody asked me, which is the preferred arm for the blood pressure? We'll talk about that. But the blood pressure is measured, and whenever you go to the GP or to the doctor or wherever, or if you're doing it yourself or go to the pharmacist, you will get 2 figures or 2 numbers. The upper number and the lower number. And the upper one is called the systolic one, and the lower number is the diastolic one. So the systolic one is the pressure when your heart pushes the blood out, and the lower one, which is the diastolic, is the pressure when the heart rests between the 2 beats. So after the 2 beats, when the heart rests, that's when you get that blood pressure. So if you get a blood pressure of about 140/90, it means that your systolic is 140 and the diastolic is 90. As a general rule, people say the ideal blood pressure is 120/80, but you're allowed for it to drop down to 90/60. So when it gets between 90 and 140, that's okay. Beyond that, you probably need to take some measures. And of course, when it's between 60 and 80 or up to 90, that is okay. Beyond that, it probably needs to be looked at as well. Something needs to be done. So this is the main slide. You need to actually understand that the WHO actually decided that 17th of May is a day for blood pressure. So it's blood pressure day is 17th of May. It just tells you how important WHO considers blood pressure problems. It's not without reason that it's called silent killer. It's a silent killer because most people have it. Millions have it. It catches up with people when they least expect it. And so most of the time, you don't know you have it. Yeah. And all of a sudden, boom, you're in the emergency department with a stroke or with a heart attack. And that's all because of the blood pressure. And it's been there telling you all the time. But of course, you didn't know about it. You didn't pay heed to it. And therefore, it caught up with you and caused you problems with the brain, the kidney, the eyes, the limbs, the heart, and all of that. So it's estimated that about 5 million people are in the UK or live in the UK with undiagnosed blood pressure problems. So that just tells you 5 million people, and more than 14 million do definitely know they have it. Yeah. And so it's just, telling you about the tip of the iceberg. You need to understand that this is a bombshell. It's like a time bomb ticking away. So you need to probably take note of that at a particular age in life, you need to look after yourself better having had the children, seeing them grown and get to adulthood and all that, you need to now, rest and look after yourself. Remember, exercise reduces your risk. And of course, if you drink, remember, drink in moderation. Drinking too much, as I say, too much of one thing is good for nothing. So you've got to understand that this is all in your interest. Yeah. So high blood pressure, we talked about already, as I say. Lifestyle habits, smoking, drinking, being overweight, we talked about already. Not exercising enough is definitely one reason why the blood pressure would go up. And sometimes if you leave it untreated, this is what we talked about, medication, I think somebody said. If you leave it untreated, it can increase your risk of developing some very serious long-term conditions, such as the angina I mentioned earlier, and of course the kidneys can fail. So some of the ways that high blood pressure can present is sometimes blood in the kidney, and of course sometimes you get chest pain because of the narrowing of the arteries surrounding the heart. Yeah. So low blood pressure obviously is less common. Yeah. So that normally happens when you either take a particular medication that would lower the blood pressure. A typical one is a painkiller called cocodamol. So anything that has got opiates, either codeine or morphine and things like that, would definitely lower the blood pressure. So you've got to be really careful when you're taking that. Yeah, there are other medications, like for example, men would know that who have suffered with prostate. The blood, the tablets for the prostate, like the tamsulosin and alfuzosin and all the others will sometimes, drop the blood pressure. Sometimes people accidentally overdose on the blood pressure tablets themselves, and that can cause that. And of course, another thing that can cause that is obviously if you're dehydrated. So if you're not well, you're not drinking much, you can get dehydrated, and that can lower the blood pressure. And of course, if you're bleeding, and sometimes even diarrhea. I've seen somebody had a very large bowel movement, and in that space of time, drop the blood pressure really, really badly. So it just goes to show you. Okay, so what we have are the types of, blood pressure. So primary, we call hypertension. Primary high blood pressure is hypertension, and secondary high blood pressure is secondary hypertension. So primarily, the primary hypertension is called essential hypertension, which you might not remember. We remember that primary is because it develops over time with no identifiable causes. So most people have this one, but people who have it don't know they have it. And that's why it's called a silent killer, because it catches up with you when you least expect it. So researchers are still unclear about why or what the mechanisms are that cause the blood pressure to slowly increase over time. A combination of factors might play a role. As we said already, genetics, the genes. So if you have a family where there's high blood pressure, then definitely it's good for you to look at, ways and means of checking it out when you get to a certain age. Yeah. Physical changes, your body, the kidneys themselves don't process the salts as best as they did when you were a bit younger. The fluid intake, that would obviously cause the blood pressure to go up. But then you have the other one, which is the dangerous one, which is the secondary hypertension, which, it often occurs quickly and can become more severe than the primary high blood pressure. And the conditions would include, as I said already, the kidney. So if you got things like kidney stones, or you got a water infection that is now backtracking up to the kidneys, that can cause. So any kidney trouble can cause, and in fact, that's the one that is most feared by clinicians, because it can cause what we call malignant hypertension, because it doesn't control a tick or doesn't heed any kind of control easily. So it becomes a bit of a problem to control it. Sometimes you might be on 3-4 tablets for it, and it might end up with a kidney failure, which would then end up needing dialysis. So these are all complications. You have sleep apnea. Yeah, so sleep apnea is so obstructive sleep apnea. That's when people who are overweight have difficulty sleeping at night, and when they sleep at night, they lie flat on their back. The tongue slips back, and obviously they end up like they're almost dead, and then they wake up with problems with breathing and of course cognition, i.e. the way they function. So they sleep more in the day than at night because of the fact that they can't sleep, and that's all because of the weight. So obstructive sleep apnea is a topic on its own that we'll deal with. You may well have heart defects that you were born with that you didn't know much about. you may well have an underactive thyroid, the gland that is in front of the neck here, and that could be a source of the blood pressure going up. Medications themselves can cause the blood pressure to go up. Use of class A drugs, cannabis and heroin and all of that, they can cause that. Cocaine and the rest of it. Alcohol abuse, being a binge drinker, chronic use of that would definitely. And of course, there's a gland that is on top of the kidneys called the adrenal gland, and that sometimes can be a source of the problem. So when someone comes to us with the blood pressure issue, or maybe it's been found, you need to be investigated, and that investigation can include, having blood tests, having a urine sample done, and having scans done. Because if you have certain tumors, growth in this particular gland, you would not be able to see it unless it's seen on a particular scan. So this is just telling you there are 5 stages of the blood pressure going up. So if you look at the green, as it's done actually green, amber, red. Obviously, we know red is dangerous. So green is ideally where we want to be. But if you're not on the green, then perhaps you'd manage to be on the amber or the yellow if you look at it. So 130 on over 85, the doctor will pat you on the back to say, yes, you've done a good job and keep that going. It begins to creep up to 140 over 90, then probably you'd be advised to make some lifestyle changes in order to reduce the blood pressure. And of course, by the time it gets to 160 over 100, then you definitely need to see your GP as soon as possible. If it creeps any higher from 160 to say 180 over 110, then definitely you will need to see it. I'm telling you this, you need to see them, because they come to us, they send them from the GP surgery to say this person has never been diagnosed with a blood pressure, but now they come to us with a blood pressure of 180 or 200 over 110. They need to be seen immediately, because they can actually burst the blood vessel, they can get a heart attack, the kidneys can begin to fail. So definitely, these are the 5 stages. So once it gets to red, you know full well that you need to come to us in the emergency department. So that's really the slide of the talk. So when people think you don't see symptoms, you don't get symptoms and all of it, these are the symptoms, and this is not exhaustive by any means, People sometimes, as I say, most of the time people come and say, oh, I've got this headache. And in fact, people who know themselves very well will tell you when the blood pressure should stop. So they are hypertensive patients, they're controlling it, the blood pressure medication and all that. But now and again, they get this headache and they say, wow, what's going on here? I think my pressure is just shot up. And true to form, bang on, as they say, you will definitely find out that the blood pressure has gone up. They could be short of breath. They definitely sometimes present with nosebleeds for no obvious reason. They're not on any blood thinning tablets. They've not had any trauma. No one has punched them or anything. They've not had a fall. They just have a nosebleed. That is another sign to say we need the blood pressure checking. Of course, flushing, well, if you are Caucasian and if you are mixed race, maybe that might apply to you. I don't know how the black person can flush and it's visible. That's just a joke. Definitely dizziness. Yeah, absolutely 100%. People who know themselves will tell you, I feel a bit, groggy, I feel a bit woozy. And that may well be because the blood pressure has gone up. And of course, the chest pain, as you can see it, if you've got angina, because of the narrowing of the blood vessels, you will definitely present sometimes with a chest pain, and that could be the blood pressure going up as well. It affects the eyes, my people. It causes problems with the eyes, and definitely the visual changes need to be taken control of. It's not without reason that people who suffer with high blood pressure, have their eyes checked regularly, same as the ones who are diabetics, because you can get what we call retinal detachment. The back of the eye comes apart, and then it causes, flushing, it causes flashing lights, it causes shadows, it causes halos, like you feel like a veil in front of you when in actual fact there's nothing there, And of course, if it affects the kidneys, it definitely can cause blood in the urine. So here you are. This is just a picture of telling you how you can present with, blood pressure that is not being controlled. The heart can fail. We talked about the visual problems already. The heart can develop a heart attack. The kidney can fail, and thereby ending up with blood in the urine and sometimes needing dialysis. And of course, importantly, sexual dysfunction. Now that a lot of people don't consider, but it is because the blood vessels are weak, and so the blood does not go into the male genital organs, and so therefore it becomes a problem with erection. So erectile dysfunction is the main thing that affects blokes, and they need to pay attention to that. Like it could be because of poorly controlled blood pressure and maybe diabetes. So that's important. So it affects men, and it's important for us to look after ourselves. This is just another one. As I say, you can present with the cerebral vascular accident, the strokes, the confusion, the headache, and sometimes you can get fits, seizures. You can get, and that could be because you've got encephalopathy, which is just the brain itself that has been affected. The blood sugars can go up, and so therefore you can go into diabetic coma. The kidneys, as we talked about it already, you can get chronic renal failure, which will need dialysis. You can get, if it affects the heart, cardiomyopathy, which can lead to heart failure. All of that. So it affects the whole of the body, and that is why you need to do blood tests regularly. You need to then keep an eye on things and all that in terms of your weight, your blood intake, your blood pressure on a regular basis, and of course, the medication you're taking, because some of them can affect the kidney, and so therefore they need to keep an eye on it. Like, for example, things like ramipril, which is an ACE inhibitor. These are all medications that you would be familiar with, but I don't want to go into that. So the primary hypertension, the way we treat it is obviously mainly by making some lifestyle changes to help reduce the blood pressure. If you take them and you do them religiously, you probably could, improve with that. But failing that, you need to be on some certain medications. As you can see, they're there, nifedipine and all the rest of it, and of course, beta blockers, and of course, water tablets, just to keep that, pressure down. That is what they use, So, as we said already, lifestyle changes and activities. There's 8. If you take nothing away at all from this talk, remember, get moving. These 8, changes are very important. So keep moving. Even if you don't have to go to the gym, just walking around your block, is important. Physical activity, focusing on your nutrition. Remember the portions, that plate size, and of course, the kind of food we eat. Reduce the carbs, more of the protein, and that protein, more of the plant protein rather than the animal protein. Less of the calories, cut the salt out. Now, for example, in my house, the past 20 years, I don't think we've eaten rice that has got salt in it. Not unless somebody brings it. Maybe someone made food for us. But in our house, when we cook rice, there's no salt in it. The salt is in the sauce, If you've been diagnosed and they've tried the lifestyle changes and they haven't worked, and you've been commenced on medication, remember to take them religiously. Yeah, that the concept is that you take them for life. However, there's a caveat there. If the blood pressure drops, so if you lose so much weight and the blood pressure drops, there are times when it could be a problem if you continue to take the blood pressure, because you can collapse, you can fall and bang your head, you can actually, do more harm to yourself. So whenever you feel like that, the GP would have to monitor what we call a medication review. So the blood pressure tablets are not there for life if at all you lose the weight, because if the blood pressure comes down, the reason for taking the blood pressure tablets is obviously to bring the pressure down. So if the pressure is down, why do you need to lower it too low? If it's too low for it to actually conduct your lifestyle, i.e. your normal day-to-day living activities, then obviously you're doing more harm to yourself. So the GP would actually control that, or even the clinicians that do that. Remember to check your blood pressure. You can invest. I think there's a competition going on, as we told. Invest on the blood pressure machine, just to monitor it and see how you are doing, and how you're controlling. Remember to lose the weight. If you drink, drink in moderation. I don't drink, so I can't advise you to drink or not drink. I can tell you don't drink, but definitely don't binge drink, and don't make it a habit where you misuse the alcohol because you've got problems, because you've got issues, you think alcohol is the answer. No, because you're drunk, you can drink yourself to a stupor. But when you come back to reality, the problem is not gone. It's still there. You still have to get ways to solve it. So alcohol is not the answer. Remember to de-stress. Remember to sleep well. Yeah, I say that, but it's a difficult situation, but try and get a routine to sleep and get yourself going. Because if you get that, you will definitely get what you're aiming for. Remember, medication, deep breathing, it's a good thing. Massages can help you. Muscle relaxation can help you. Yoga, Tai Chi, and all of that can help you, definitely. So here you go. That's just the foods that we think would help with that. More of the plant, less of the animal or the meat, and see how it goes. You can see that yourself. Eating with high blood pressure, the foods you want to avoid. That's top there. Salt. We talked about that. This deli meat, frozen pizza, pickles, canned soups. They're full of, things there that would get the pressure to go up. Tomato products or tomato products, depending on how you pronounce it. Sugar, that's it. That's absolutely right. People that drink like this Coca-Cola, the full fat Coca-Cola has got almost equivalent of 7 spoons of sugar. That's not going to do well for you because as you grow older, the pancreas doesn't do as much. It's not as much as it should be in terms of reaction, because it produces the stuff that makes the sugar come down. When it's too low, it produces something that makes the sugar go up. So if you're now bombarding it with that amount of sugar, then obviously at some point it might pack in, and that would cause you diabetes. Packaged stuff, food stuff is definitely something to try and avoid. I'm not saying don't have it, but try and reduce the amount you take. Yeah. So I'll end here, but I have another set of questions that I have that I've actually tried to respond to. I just grouped them. But if you're happy with this, we can stop here. If you want us to continue with the questions, I can actually give you the ones that I've actually tried to answer, and then we'll see how we go from there. So whichever way you want us to do it, I can do that.
Thank you so much, Dr. Kamara. You can go ahead with your questions, and then we can move to the next phase. So what's going to happen now is once Dr. Kamara is finished with his bits, we will then post the questions, which will lead people to participate and win the monitors. Win to go into the draw to win the monitors. And then we'll just briefly, for those of you who are not familiar, really, please do pardon us if this feels a bit like an insult. We've been on Zoom for ages, so I'm sure most people know. But just for those who may not know how to type something in the chat box, for instance, if you hover on the bottom of your screen, you will see an icon which says chat. And if you click on that box, it opens up a dialog box and you can put the information in there. And that's how you can chat. Equally, there's another button where it says reactions. And if you click on that, you can either raise your hand up or give a thumbs up, whatever. So this is purely for people who may not know how to use the chat box. If we do have the time, we'll let people unmute to ask their questions. But yeah, please, Dr. Kamara, you carry on with those questions, please.
Thank you. So here you go. So how can I, how can I quickly lower my blood pressure? Now, here you are. Exercise most days of the week, and the exercise is the most effective way of actually lowering your blood pressure. We talked about this, the salt already. Too much sodium would definitely, can cause the blood pressure to go up. Limit the alcohol you take to no more than 1 to 2 drinks a day. I think the guidance we received is like 14 units a week. Make stress reduction your priority. We talked about that. So stress, de-stress, less alcohol, less salt, exercise more, move more, and that should definitely help you to bring down the blood pressure. Somebody asked this question: does caffeine affect the blood pressure? Well, of course. Caffeine can cause a short but dramatic increase in your blood pressure. And even if you don't have blood pressure, the caffeine that you take, people who drink coffee in the morning to get them going, obviously it gives them that kick and that goes up. Why the spike is in that, I'm not sure, but I know cola nuts we have in Africa, cola nuts. We used to use that. We used to eat that to keep us awake at night. And indeed, Coca-Cola is made from that. So it's got caffeine in it, that cola nut, So if you take too much of it, obviously, it'll keep you awake and it'll keep you just going, really. And of course, the blood pressure will go up with that. But then some researchers believe that caffeine can block a hormone that helps keep your arteries widened. That's very interesting, but that's what the researchers believe, that it can block a hormone that keeps your, that helps to keep your arteries widened. So food for thought there. Does tea affect the blood pressure? That's another one, because if you're not taking tea, you're taking coffee. So if you're not taking coffee, you're taking tea. Now, tea contains caffeine itself, believe it or not. Too much of tea, of course, can get the blood pressure to go up, but it's only for a short term. So if you think by drinking the tea or the coffee, and that's why the blood pressure has stayed up, well, I think you need to be considering that to be monitored, because the GPs can monitor it. They can actually put that cough on you for a few days, and that would tell how the pattern is of the blood pressure rising and coming down, really. So there's some study that showed that the acute hypertensive effect of the tea drinking was blunted when the tea was consumed with food. So the initial blood pressure is another factor that should be considered in doing this. So in effect, when you take tea with food, you know, they say the effect of the tea, i.e. the caffeine on it, was blunted when you took it with food rather than on its own. So it's just something to consider, just little nuggets of way how to control the blood pressure. Now, this is the big one. Can anxiety cause high blood pressure? Well, of course, it's you know, a given. But what it doesn't do is cause a long-term increase or rise in the blood pressure. So if you're anxious, say, for example, you see a snake, you know, I don't know how many people like snakes, but when I see something like that, oof, I'll just run away, and that would cause my blood pressure to go up. There's no questions about that. But then that will come down afterwards, you know. So, but for it to stay high up there, clearly there's something else that is causing it. And that is why it's just, when you're faced with this negative stressor, it's just a temporary spike, a temporary rise in your blood pressure, and not there all the time. People asked me about milk. Does milk increase the blood pressure? Well, milk is an excellent source of calcium, and it's low in fat. So it's some of us that drink the semi-skimmed or the skimmed. The calcium is, you know, and the milk itself being a source of protein. These are very important elements of a diet for lowering the blood pressure. So according to the American Heart Association, women who ate 5 or more helpings of yogurt a week experienced a 20% reduction in their risk of developing high blood pressure. Yeah, that does not mean you have to overdo it. So because they say 5, you'd have to, like, you know, double it or quadruple it. It doesn't work like that. There are other things to help with that. Is cheese bad for the blood pressure? Well, again, it's a great source of protein and calcium. Sorry. But it's often very, very high in saturated fat. And of course, it's got a lot of salt in it. So eating too much of it can lead to high cholesterol. And inadvertently, you probably will be increasing your blood pressure or raising it, thereby increasing your risk of developing cardiovascular disease, you know, diseases to do with the heart and the blood vessels. So somebody asked, if I don't eat, if I, you know, starve myself, can the blood pressure go up or not? Well, according to the Cleveland Clinic, fasting can help lower the blood pressure. So there is something called intermittent fasting, which helps both with the weight and, of course, with the blood pressure. But then in doing so, you got to be really careful, because sometimes it can also result in an electrolyte imbalance. That can make you then prone to irregular heartbeats, you know. And so it's important to do things in moderation. As I say, he that drinks with measures, he is pleasure. So he is pleasure, he that drinks with measures. So everything in moderation is a good thing. Overdoing it, too much of it, obviously, is not good for anything. So what is a good snack for high blood pressure? Well, according to the macrobiotic nutritionist and health practitioner, Shilpa Arora, you know, an Indian lady, loading up on foods rich in potassium and magnesium is very essential for those dealing with blood pressure. Things like, or fruits like dates, you know, prunes, bananas, pomegranate, walnuts, healthy fats, pumpkin seeds, and coconut flesh are good, you know, options in terms of the snacks, you know. So that's something, you know, food for thought. You know. Is peanut butter good for high blood pressure? Well, the peanuts contain nutrients that help to lower the blood pressure. They've got magnesium and potassium, 2 of those elements or minerals that you need to help control your blood pressure. The fiber and the protein in the peanuts are very helpful as well with your bowels, you know. You probably know that there is the salted version and there's the unsalted version, and we're talking about reducing the blood pressure. And of course, if you reduce the salt, you would reduce the blood pressure. So the salted peanuts you want to avoid. They help with the blood pressure, but not the salted ones. So the non-salted ones are the ones, and even that you take in moderation, because they have, you know, protein that may well, high fat, so therefore you need to do things, as I said. I can't emphasize it enough. Take it in moderation. So which arm, this is it I was talking about. So which arm the blood pressure can be measured on, right or left? Well, from what we've been told, it is best to take your blood pressure from your left arm if you're right-handed. Yeah, so if you're right-handed, it's best to take it on the left arm. However, you can use the other arm if you have been told to do so by your healthcare provider. So remember, resting in a chair next to a table for 5 to 10 minutes, your left arm should rest comfortably at the height of your heart. This is very important. Most of the time you go to the GP, what you have is you resting there and nobody's lifting that arm to that level where your heart is. Yeah, it might give you a false reading. So it's important to remember this, that you definitely, if you are left-handed, you probably are better off doing it on your right arm. However, they might tell you otherwise, but that's what I've been told. Food for thought, people might differ, but it's important to remember that, you need 5-10 minutes when the blood pressure can be rechecked. That way, at least you get a good reading, rather than somebody going to the doctor, they're anxious, they've got the white coat syndrome, the catecholamines, the adrenaline is moving, the blood pressure goes up and they test it, and sadly it's very high. Whereas at home, it could be less. So it's important sometimes to say, well, I tell you what, they have to monitor it. And the way they monitor it is by giving you this cuff machine, which you put on, and it keeps going up and down, squeezes the arm up and down, reading it and recording it. And so they have like a map, they have like a pattern, they have like a regime that the blood pressure fluctuates on between high and low. And that's how they can come to a decision. This person has got it or has not got it, or it's not being controlled, and therefore we need to do something different. What time of the day is the blood pressure lowest? Again, we mentioned this earlier. As I said, at night, whilst you're sleeping, you're resting, definitely the blood pressure starts to go down and it starts to rise a few hours before you wake up. So the blood pressure continues to rise during the day, and usually it peaks around midday, 12 o'clock in the afternoon. So usually the best way of actually measuring the blood pressure is when you just wake up. Just when you wake up, you relax and then you put it on. That way, not when you're pottering about when you started, because it definitely will give you a higher reading because you're doing what you have to do already. So this is a very interesting question. So every time I do my blood pressure, I measure it, it is different. Why is that? Well, it varies, as I said. If you're actually listening to something, maybe something that is, pleasing to the mind, to the brain, you definitely would enjoy that. And so obviously it'll be less. If you are obviously doing a bit more strenuous activities, definitely it will go up, but the question is, when it goes up, it comes back down. The issue is, if it doesn't come down, what is that? And that is why you need to be mindful. But because it doesn't tell you when it's up or down, if it's, you need to then keep an eye on it and make sure that the variation is normal rather than an abnormality. Because if it is an abnormal one, then it needs to be looked at. But you get to look at it if you present with it. Yeah, I think I hinted on that already. So blood pressure affecting the man sexually. Now, obviously, the decreased blood flow makes it difficult for men to achieve, maintain erections. And this is called erectile dysfunction. Now, that problem is fairly common. Blood pressure can do that, and it actually affects libido, which is the sexual desire. And sometimes the erectile dysfunction could be because of anxiety. It could be because of diabetes. And sometimes even the blood pressure medication can actually cause that. So it's something that you need to take. It's a multi-pronged approach. It's a multifactorial thing, and it needs to be investigated. If any male amongst us is experiencing that, then it needs to be investigated and thoroughly, so that we ensure whether it's anxiety alone or whether it's something else, including the blood pressure or diabetes that has not been, if you like, diagnosed. Does walking reduce the blood pressure? 10 minutes of brisk walking, which is the best thing you can do for yourself, 3 times a day or maybe 3 times a week, if you can't, you have a busy lifestyle. But if you can do it at least, 3 times a week, you don't have to go to the gym. You just have to walk around either in the morning or in the evening or something, especially after a heavy meal or something. You would definitely enjoy that, and you would get better in terms of your blood pressure. It lowers it by reducing the blood vessels, the stiffness of it. As we grow older, the blood vessels become stiff. So what you have is something that helps with that stiffness, and so the blood can flow easily. And if, the effects of the exercise are most noticeable during and immediately after a workout. Some people measure their blood pressure before they go for the workout, and then when they finish it, they measure it, and then of course they notice a difference, and that can probably incentivize them and motivate them to continue with that. So food, medicine, lifestyle, age, and genetics definitely have a big role to play in the blood pressure control. Common factors that can lead to high blood pressure include a high diet, a diet that is high in fat, in salt, and of course, the animal protein. The kidney and hormonal problems definitely do, including diabetes, endocrine problems, and high cholesterol. These are all issues, these are all factors, risk factors that actually would impact the control of the blood pressure. So thank you for that, and I'm happy to take any questions.
Thank you for that. What a wonderful, wonderful session and very interactive. Thank you, Dr. Kamara, Dr. Mohamed Kamara, as always. Lovely to have you, and it's been so interesting. Now, as you can probably see, okay, you said you couldn't see, sorry. There are questions popping into the chat box, but you've probably touched on most of the things that people are asking about. So that was really useful, those common questions that you've encountered, because I know you've given this talk over and over and over again. So you know what the themes are. God bless you for that. So just a few take-home points, just to hammer. Dr. Kamara has been telling us about blood pressure control. He's also mentioned the fact that over 5 million people go undiagnosed, probably more, because maybe this number is even underrepresented.
Yeah.
And he's talked us through lots of risk factors that we can control, things that we can do to make this prevention possible. And he's given us a lot of things to be aware about in terms of blood pressure. Right, so as we said at the beginning, we are giving away 5 blood pressure monitors for people who get these questions correctly. Ngozi, please, are you able to post the questions in the chat box for us? Are you able to post the questions in the chat box right now? So the ways that you can win, you can either text your answers, or did you say call as well, Ngozi, these numbers? 07. Okay,
yes,
you're
you
going to
can
put
call.
it in the chat box.
You can
yeah.
call as well. Yes.
Okay, so people can call as well. 07493 849910 or 07385 608 328. The details will be posted in the chat box. Also, you can post your answers there, and please try and do that by 12:15 so that we can enter people into a draw. And the winners will be announced next week. So you need to keep tuned in next week. Right. So Dr. Kamara, some questions for you. As the discussion has gone on, we've had people asking questions in relation to a few themes. So one of the questions that has come up is, let me just find it because I wrote it down. So someone was asking, can certain foods like grapefruit interfere with blood pressure medication? And just along the lines of food and diet, pink Himalayan salt. So we hear a lot about Himalayan salt these days. Is that necessarily better, a better option of salt? Is it good for our blood pressure? Is it okay to take? Is it not? So the two things which are kind of food or diet related: grapefruit affecting blood pressure medication and Himalayan salt, or any kind of special salts. Thank you.
Well, I mean, I'm not a dietitian, so I can only tell you what I know. But anything that is rich in salt, be it soy salts, be it Himalayan salts or whatever, is something as a hypertensive you need to avoid as best you can. I mean, when I say avoid, I don't mean you have to avoid it completely. You can take it in moderation, maybe once a week, twice a week, but to be on that for 7 times a week, definitely I wouldn't have thought is probably the best way forward. That's one thing. So, I mean, the dietitians will probably be able to break that down in terms of the salt, contents in it. But anything that is high in salt, be it a sauce or an ingredient, or like Maggi sauce and all that, or something like salted peanuts, or then definitely something you have to take in moderation, very low. The other thing about the grapefruit In medicine, we have what we call interaction. So when you take certain tablets, sometimes they interact. For example, a very easy example is people who maybe have had a blood clot in the leg, and in the times gone by, we used to give warfarin, the blood thinner. And warfarin, we know, is rat poison, believe it or not. And so definitely, when you take that, there are certain antibiotics that if you take them, they interact with the warfarin and they cause the warfarin to do more, i.e. it potentiates, that's the word, and I don't want to use this big word. What it does is it increases the effect of the thinning of the blood. So in effect, when you take warfarin, we monitor the effect of the thinning of the blood. So it's like for someone who's just had a clot, it's probably between 2 and 2.5 or 2 to 3. Someone who's got a valve, a metallic valve in their heart, theirs might be a bit higher, so 3 to 3.5 or something like that. But imagine you now are taking something that would increase it, to 7 to 8. You now at the other side or the other end of the spectrum where you are more at risk. So therefore, you would bleed easily. And that bleeding is very difficult to stop because you need certain products to try and reverse that effect of the bleeding. And that is where the danger lies. So what grapefruit has been found to do is potentiate the effect of the blood pressure. Yeah, either brings it down or takes it up. So you need to be careful with that. So if they put it in the medication, that label to say, don't take that with that, is with the reasoning that it actually causes problems for you and therefore avoid it as best you can. It's as simple as that. So that's what grapefruit does with the blood pressure medication. It interacts with it and then causes more problems. So again, another example is people who've got mental health problems and they're on lithium. It's a tablet called lithium. So lithium interacts with anti-inflammatories, the likes of ibuprofen. So if somebody who's on lithium comes to me and they've got an injury to the ankle, for example, or to the wrist, if I'm giving them a painkiller, knowing full well that if I give them an anti-inflammatory, and it would actually cause them more problems in terms of the toxicity. Yeah, because when you take a tablet, it is actually to treat something. So that's what we call therapeutic. When it goes beyond that, it becomes toxic, which means it's a poison. So it actually poisons the body. And what we don't do as medics is we first do no harm. So we don't want to cause more problems than you have already. So therefore, we control that. And so if I was giving a painkiller to somebody with lithium, I would be very careful when I give anti-inflammatories. I wouldn't even give it. I would give something that is not an anti-inflammatory, for example, codeine and paracetamol, as opposed to giving ibuprofen. I hope I'm making myself
yes,
clear.
You are. Thank you. Thanks for answering that. And also, we do have Healthy Heart sessions on Tuesdays. We have dietitians who come on to talk about diet, and we've also got people who tell us about lifestyle. So please do tune into these Tuesday sessions, and you will know a bit more about, dietary measures that can improve our health. But thank you for that, Dr. Mohamed Kamara. The 3 questions for winning the blood pressure monitors: what 3 things can cause high blood pressure? What 2 health problems can be associated with high blood pressure? And how do you know if you have high blood pressure? So that's for you to chew over and answer as we go along. So to you, Dr. Kamara, please, are there any long-term effects of taking amlodipine? Someone would like to know. And also someone is asking, are there any specific blood pressure monitors that you would recommend? I know probably what you're going to say, but I'll leave that to you, please. Thanks.
Yeah, the blood pressure monitor as well. I don't want to sound, because I have no interest and nothing to declare in terms of conflicting issues here. Conflict of interest. I don't want to be involved in, and I'm not a rep of any company. But I think a blood pressure machine that would cost you at least 20 quid and above is one that you can safely say you can rely on in terms of what it gives you as a reading. Because sometimes a lot of people don't understand that if you take the automated ones nowadays, where you put it on the finger and things like that. Now, if the finger is damp, you wouldn't get much from it. It wouldn't give you an accurate reading. If the cuff is bigger than what you need, it would give you an inaccurate reading. If the cuff is smaller, it will give you an inaccurate reading. So there are all these things to consider. So I'd say one thing you can do is invest in one that is actually recommended. You can see the star ratings anyway. So anything that is a 4-star or 3-star, it wouldn't cost you 50 quid. You know, it will cost you maybe 20, 30 quid, and then invest in that one, and you'll be glad you did, because it actually stand you in good stead. Yeah. In terms of amlodipine, well, amlodipine, as you know, is one of those that is very, what's the word for it? That's the one they actually prescribe to us, people of color. Yeah, most of the time. It has got one of these notorious side effects. That is the fluid retention, the swelling of the limbs, edema in the lower limbs. People, I've seen somebody, he got so bad that they can hardly walk. Yeah, so they then needed to actually look at probably ways of trying to get rid of that fluid retention, and then they gave them some water tablets, which again is like trying to rob Peter to pay Paul. So you got to be careful with that. Yeah, it's important you get that balance right, and that's why you see GPs are there in the middle to help. Dr. Asante knows I'm not providing or creating more work for her, but that's how it is. They're there. They're the middle people. They're the ones that see you all the time, and they're the ones that could definitely help in monitoring that. And if at all, when they can't do that, they send you to us, and we then take it from there. But remember that amlodipine, like all the other medications, they do have side effects. Some might be long-term, some might be short-term, but I think you're better off with those than not really, because what you don't want is a stroke or a heart attack or a kidney failure or being blind. I think that's the price you pay, and that's the balance you need to have, really.
Absolutely. Completely agree with that. And just bear in mind as well that any medication has some side effects, but it's a balancing act between the benefits and the side effects or the risk. So please, if it's not agreeing with you, as Dr. Kamara said, speak to your GP or speak to your clinician, and there are always alternatives that we can consider. So hopefully that helps. So Dr. Kamara, Barbara is saying that I was prescribed high blood pressure medication following an acute episode of hypertension in April 2021, and my blood pressure has been normal since. Do I still need to take the tablets more than a year after the episode? So she was prescribed 10 milligrams amlodipine. She said her blood pressure is fine. Does she still need to carry on taking those blood pressure medications? That's her question.
That's a good question. Now, I am thankful that you asked that question. Now, the problem with the blood pressure is it creeps up on you. I want you to bear that in mind. Something that is there, but you don't see it, you don't feel it. That is the danger of it. And I think the best person to make that decision of you coming off those hypertensive, antihypertensives is the GP, because they will monitor it. They'll keep an eye on it. As I said, if you lose the weight, like for example, you lose 20 kilos of your original weight, that would impact your blood pressure. That would impact your blood sugar control. There's no questions about that. Yeah. So if you're weighing 100 kilos and you lose, say, 20 kilos of that, I guarantee you that would affect your blood pressure. The problem I have, though, is losing the weight, for example, is not necessarily equal to the blood pressure going down. Some people say when you're overweight, that's when the blood pressure goes up. No. You can be as thin as a rake, you still have the blood pressure, because maybe you've inherited the genes. Remember that. So we have two sides to look at. The factors, risk factors that you can take care of, you can do something about, or the ones that you can't do much about. And that's, as I say, is the gene. So that plays a big, big role, in what happens. Obviously, there's nature, there's nurture. And we need to look after nurture. We can't do much about nature. So the thing about it is that 120/80, brilliant, yeah? But is it that all the time? There's a caveat there. So if it peaks up, you don't know about it, I think you need to get the GP involved in making that decision of you coming off those medications. Please, please, please don't do that. Don't take that decision on your own, because things might just, end up backfiring. And I think you don't want to do that. But get the GP involved. And I'm sure if you need to come off that medication, they'll gladly do that, because that's what they like to do.
Thank you. And that's a very useful question, Barbara. Thanks for asking that, because there are a lot of people who have that dilemma, isn't it? And sometimes I have patients who go, oh, actually, I haven't been taking it for a while because my blood pressure was fine. And I thought, maybe you should have let us know about this. But yeah, you're right. We best discussed with your clinician. Dr. Kamara, does amlodipine, Amy in Cancer Frimpong is asking, does amlodipine have an adverse interaction with grapefruit juice? And then Iyabo is saying, my blood pressure is high when I wake up, but goes down when I start activities, and I sleep very well. He's a lucky one.
It is, yeah.
Yeah,
I mean, as I say, any of those that would cause that would have that label on it, because one thing the pharmacist or the chemist don't want is the suits. So definitely will advise you what would interact, with the grapefruit and things like that. So just keep an eye on that, because the label, if you read it, where your name is, underneath that, they'll tell you, don't take this medication with grapefruit. It's there, it's clear. So if amlodipine is one of them, then definitely I'd advise that you heed that advice.
Okay, thank you. So do read the labels that you're given, or ask your pharmacist, because they can tell you what interacts with what. Generally, we know that the anticoagulants, like you were saying, the warfarin is a big one with the grapefruit. So comments and sort of feedback for you, Dr. Kamara, as always. Lovely presentation, very insightful, very educational. Well done, amazing presentation, somebody said. So just to let you know.
Thank you for that.
You're being appreciated, as always. So another question is, sorry, I'm trawling through quite a few messages here because we had some of those answers dropped in as well. So we've talked about Nishrat's question. Right. So Akosia Dejan is asking, can pregnancy alone increase my risk of high blood pressure? Can pregnancy-induced high blood pressure be long-term following delivery? So that's from Akosia Dejan.
I didn't want to go into the specific, what's the word for it? Special, if you like.
Types of,
types of hypertension. And one of them, obviously, is preeclampsia, which is what I think the questioner is alluding to. Mm-hmm. Now, that is a very difficult thing to go into in terms of the topic, to actually give you an answer, in just a few words, because it's a different thing altogether. It's obviously induced by the pregnancy, and so therefore you'd expect for it to go down a bit like gestational diabetes. But the blood sugar goes up when you're pregnant, and then you expect it to go down after delivery. However, according to research, 50% of those sometimes come back, and haunt you in later life, i.e. maybe in postmenopause. Some people get this diabetes, secondary diabetes or type 2 diabetes. Same applies. So the blood pressure, as I say, because it's not a constant thing, it is very difficult for anyone to tell you that this is what is going to happen. There's no questions about that. But obviously, we know we monitor our hypertensive patients, very, very closely, especially the ones who had it in pregnancy. This is why the urine sample is done. This is why the blood pressure, whilst you're pregnant, and it keeps, going up, they always, in fact, to a point where if it goes too rapidly, when you put on the weight and you then retain the fluid, they admit you for observations. And sometimes they might even end up in hospital for maybe a week or two. And sometimes you might even end up having a cesarean section just to prevent you developing seizures. So it's a big topic, and maybe we can go into that later on at some point, but it's important to remember that blood pressure needs to be kept an eye on, whether be it with pregnancy or without. Remember, keep an eye on the blood pressure. You can measure it yourself, and if you're not, then the GP's surgery will gladly do that. They have the nursing staff, they have the practice, personnel who can do that for you at any time. And even to the chemist, if you're going into the chemist, they can do that easily for you. Simple as that. And that way you know what you are. But if you invest on this blood pressure pump or machine that I'm talking about, you can do it in the comfort of your home without the influence of that white coat syndrome. I know when we go to the GPs, we're worried, we're concerned. So the blood pressure, it definitely goes up as a result. There's no questions about that. So remember, keep an eye on it. And of course, you will be well with that. Thank you.
Thank you for that. Thank you. And Akosia, I hope that helps. And I'm sure Akosia is a midwife herself, so I'm sure she probably knows that when people have blood pressure in pregnancy, we do carry on monitoring them closely, because some people, that might be the first sign of someone actually being hypertensive and is presenting in pregnancy, and they carry on with it, as Dr. Kamara said, or it might be that actually things settle and they don't carry on, but it's important to get monitored. So thanks for that comment, question, Akosia. Margaret Dash says, thanks for this informative session. And Betty is asking, is there a holistic approach? I don't want to take medications forever. Is there a holistic approach to dealing with high blood pressure? And Ngozi has raised her hand. So after that question, Ngozi, please unmute yourself and ask your question. Thank you. Over to you, Dr. Kamara.
There's the breathing exercises that have helped. I invested in a machine that helps with my breathing, and that obviously impacts my blood pressure. I move about in my work, as you know, an A&E clinician. Most of the time you open about trying to make sure things are running smooth. I have a department, a pediatric department, which is 2 floors up. So I go up those, maybe 2-3 times a day, when I'm there at work. So that's all part of, the moving, the mobility. As we're getting older, as I say, the BP is there creeping up. And so therefore we have to do things that are necessary. So the holistic approach you're talking about, of course, people revert to conventional, like, herbs and things and all that. Now, as I say, my worry with that is, are there any measures? Have there been any robust research, taking place that would tell you what about the side effects, what about the interaction and things like that? So it's a difficult one. I can't, knock the conventional, the conservative medicines and things like that. But all I know is that if you've got it, you've got to deal with it. Now, whether you combine conventional medicine plus, the holistic approach, the medication plus that's one thing or the other. But please, please, please remember, if you're doing the herbs, remember you actually tying yourself to something that you know not much about. And therefore, my advice to you is stick to what you know. At least you've got some measures to actually fall back on in terms of what happens and what can be done. So exercise, lose weight, breathing exercises and all that would be helpful. No questions about that. But the key thing here is the GPs, the clinicians in the hospitals are there for a reason. They went to medical school for a reason. And so therefore they're best placed to actually advise you and monitor how this blood pressure is behaving. Thank you.
Thank you. Thank you so much for that. Ngozi, are you able to unmute yourself and ask your question, please?
Yes, thank you. Thank you very much, Dr. Dan, and thank you, Dr. Kamara. Just a quick question. I had to do a spirometry test last week, and they said that for me to even start the test, they had to bring the blood pressure had to be at least the bottom one. I can't remember what it had to be, at least 90. So because I was rushing to go there. So first question is, when you rush before you do your blood pressure, does that obviously make it higher? And I just wondered why they needed to get it to a certain level before I could do it. Because at the end of the day, when I did the different tests, they said that I lost the chances because I needed to do it, I think 6 times for the different ones. I have to go back and repeat it. So I just want to, know what tips to take before I go again, and why did they have to get it to 90 before doing that test? Thank you.
Well, that's interesting. It's a good question. Now, spirometry, I believe, is got to do with the lungs, respiration. That's the thing. So people who have shortness of breath, difficulties breathing, and when they exert themselves, sometimes people who smoke and have COPD and things like that. The managing of the respiratory system, the lungs, is what they use that spirometry for, to see whether someone can be diagnosed with COPD or without, and how they're monitored. Anything to do with that, obviously, is one thing you do. Spirometry. These are mainly the respiratory physicians, that deal with that. But by and large, remember, there are guidelines. It's a bit like me coming to you and you doing your job and you telling me for you to do that job, you need to have ABC. If I don't comply with ABC, you would not be able to do your job. And so one of the reasons why they would want you to blow into that and the blood pressure to be at that is because whilst blowing, you're straining yourself. Remember that. And that would get the blood pressure up. And if it's already high there is that distinct possibility. I'm not saying it's going to happen that you can pop a blood vessel and that can result in a stroke. You see, so they don't want to take that responsibility. And so therefore, they want you to bring it down to a certain level whereby they will then be able to, do that safely. Remember, the first rule of medicine is safety. First, do no harm. And we need to keep you safe. So if by doing what we do, we expose you to more harm, obviously, the suits will be there forever. And we don't want that.
Thank you.
Thank you.
Yeah, so Ngozi, get your blood pressure down so that you can have your spirometry done.
Thank you so much.
Bless you. Thank you for that, Dr. Kamara.
Abdullah Ahmed, I think I can see a hand up.
Abdullah Ahmed's hand is up. Yeah, please unmute yourself.
Yes, sir. Good morning from Freetown, and then good afternoon for you guys in the UK. I am Abdallah Ahmad Sise from Freetown in Sierra Leone.
Wow.
First and foremost, I want to commend especially the conveners, the organizers of this wonderful session, more especially to the presenter, Dr. Mohamed Kamara. Of course, he's one of our best experts from this country. We do consider him as a gem. For us in Sierra Leone, he's one of our gems, so we are proud of him. So the presentation did not come as a surprise to me because I know he can do just that. Personally, as an individual, I think the importance of this session cannot in any way be overemphasized on my part, because I am coming from an hypertensive family, so to speak. My dad was hypertensive, and of course, my mom is living with the condition. So I want to assure Dr. Kamara personally that I'm going to adhere to the instructions, and everything that I have learned today, I am definitely going to strictly adhere to everything. But my only concern, of course, you highlighted one particular area that sugar is one of the triggers. And I want to know if we can substitute it with honey, because currently as an individual, I have stopped consuming sugar for quite a very long period of time. I have substituted sugar with honey for quite a long period of time. I don't know whether that one is healthy. Should I continue in that particular direction, or if there is any advice you can give to that, let me know. Thank you very much, sir.
Yes, thank you very much for sharing that, Mr. Sise, and grateful for you to join us this morning. Now, obviously, as I said, you sadly, unfortunately, you have the genes, as you say, and so obviously there is the distinct possibility of you developing the illness at a particular stage in life. It doesn't mean it's a definite, but it can happen because, as I say, there's nature, there's nurture. Nature, we can't do much about. Nurture, which is related to the second part of the question, i.e. the honey, we can do a bit about. So the short answer to that is honey is a natural sugar, obviously. Again, too much of that is not good for you. It's as simple as that. So if you have to take it, maybe take one. But as I say, the reason with the sugar content is that if you're not aware that maybe your what they call it, I always tell people is HSBC bank. That's the easiest way I can get people to remember it. The WHO has said a blood test called HbA1c, and so people find it difficult to remember that HbA1. So I always tell them HSBC bank. If you're in the UK, you know that. So that blood test would actually identify the ones who are more at risk and who are less. So that gets checked together with your blood pressure annual MOT, if you like, annual review. Yeah, so that gets checked. And if it gets to beyond 48, then they need to be thinking about the possibility of diabetes. And sadly, the dangerous combo you have is where you have hypertension as well as diabetes. Yeah, it's a very dangerous combo. So therefore, that needs to be looked into. So it is important to remember that honey is natural sugars, but of course, you take it moderately and you would actually benefit from it because it's been known to have medicinal properties. No questions about that. But as I say, if you take things in moderation, you'd obviously benefit from them. If you overdo that, then obviously you would have a problem. So people who've been told they've got diabetes, then clearly they have a substitute, which is the sweetener instead of the sugar. As I say, 1 can of Coca-Cola has got the equivalent of 7 spoons of sugar. So, and that just tells you, if you drink 2-3 of that a day, well, that's like what? 21 spoons of sugar. That can't be good for the pancreas, which is what controls that. So therefore, it's important to do things in moderation and get them checked. And that way you'll get things going definitely to the best of your ability.
Thank you.
Thank you.
Thank you. And thank you so much for that wonderful feedback all the way from Sierra Leone. Sierra Leone is actually dear to my heart, although I don't come from there. We've lived there when I was little. So Segwema, Kailango, Kwendu. So it's nice. Good. It's nice to hear, and I can speak Mende as well. So
look
yeah,
at you.
so yeah, showing off a bit here. I'm sorry. Right. So we do have quite a few questions, so we'll fire away. I will kindly crave your indulgence that we might just overrun by a few more minutes, if that's okay, so that we can get everyone's question answered. Mr. Sise, you can lower your hand, please. Thank you. Thanks for that question. So Joseph Kolako says, I'm 50 years old what is the recommended blood pressure reading for my age? So Dr. Kamara gave us some figures and he said, ideally try and keep it below 140/90. We know that in diabetics, the threshold is lower. So for diabetics, your threshold or your aim, your target is 130/80. But essentially, the lower, the better, so that you don't end up in those other ranges that he talked about, the severe and the very severe and the emergency ranges. But we'll pop those, numbers in the chat box again, if that helps, Joseph. Thank you for that, Joseph. Olanike says, thanks, Dr. Kamara, fantastic presentation. Nancy says, what causes tickling in the lower hip? So I'm not sure whether she means tingling or tickling. Amy in Cancer is saying, thanks so much to all the stakeholders, interactive talk and all of that. So the one about the tickling or the tingling in the lower hip, I'll probably let you touch on.
I think they're probably referring to tingling in the lower limbs, in the feet.
Tingling.
Yeah. So that may well be either some problems with the nerves or with the blood vessels. Now, people who smoke, obviously, as we grow older, the blood vessels in the lower limbs do get harder, and so therefore that can cause problems with circulation. So you get pain, you get reduced sensation. Same as people who are diabetic. They're called diabetic, neuropathy. And obviously that's why it's important, if you're diabetic, every 6 months you get that tested, to make sure that you don't get injured without you knowing it, because the sensation is lost, the nerve endings are numbed, and so therefore you don't feel. And that's why we always advise people, before you put your shoe on, make sure there's no stone or there's no anything in there, because you can prick yourself, you can get that wound, you don't know you have it because you don't have the full sensation, and until it gets actually infected, you might not even know, and by then it becomes a bit difficult to treat. So it's important to just think about it. If you've got tingling in the lower limbs, then it's important to get that checked out. Either go to the GP or come to us on the emergency department, and we'll definitely see what we can do for you.
Okay, you're going to regret saying that now. We'll all be coming to the emergency department.
This is what has been happening anyway.
Bless you. Thank you. So I also want to acknowledge all the answers that people are putting in the chat box. Well done. I can see the participation is really great, and it is being monitored. Your answers are being picked up. So please, we do recognize that people are posting their answers. Amy in Cancer Frimpong says, can progressive breathing exercise techniques help? So I think Dr. Kamara has touched on that. Anything that helps you to de-stress and to relax yourself is useful. So again, Amy is saying, can meditation help to reduce stress and distraction?
100%.
Yeah, and so that's also useful. Akosia Dejan is saying, my mother is 64 now and was diagnosed with hypertension 30 years ago. She has managed her blood pressure with medications. Is there any possibility of her ever coming off these meds? So I think you've touched on that, but maybe briefly you can answer that question.
Yeah, no, as I say, it just needs to be kept in mind, because sometimes, when they touch like 70 or maybe 80, you see them coming in and they're collapsing. So to me, we've got guidelines. Anybody above 65, if they come in having had a fall, for me, it's a collapse until proved otherwise. It's not a mechanical fall where somebody tripped on something, unless I can prove it. If not, as long as they're above 65. So when they come in and I know they're hypertensive, one thing I always do is check their blood pressure when they're lying down or sitting, and 5 minutes later when they stand up. And invariably, the blood pressure can drop because of the blood pressure tablets. So therefore, if it's very low, there's, as I said earlier on, there's nothing we can do but withdraw those blood pressure tablets until we can get the blood pressure back to where we want it. Another thing is, if the blood pressure drops to more than 20 between standing and sitting down, then obviously it may well be a sign of problems with the renal glands, and so therefore they have a particular test they will conduct in hospital, which is called the Synagen Test. That is just for the medics. They will do that just to make sure there's nothing happening in the brain, because such people, they might need something to sort of prop up their blood pressure, and that is all something to do. So if that is happening, then obviously it needs to be done. But I can't tell you that they will take her away or take the blood pressure medication away from her, not unless that happens, where they drop the blood pressure precipitously to the point where they're more in danger, and so therefore they would have to be withdrawn with a view to normalizing it and then going forward from there.
Thank you for that. I hope that helps, Akosia. And Val, your comment, good, informative / educational session on BP. It is always good to be given information in a format that allows individual answers to be asked and answered. So thanks for that, Val. Amy says, can moving more help reducing blood pressure? So yes, Dr. Kamara has said that. Thanks for that, Amy. ZG says, yes, honey, a good point. What about organic honey as a replacement for sugar? So I guess along the same themes that Dr. Kamara mentioned. Landay, again, I think you're also commenting on how good the session has been. And V Ebanks, V, you were on the session a few weeks ago, and she's saying thanks for an informative and life-saving presentation, Dr. Kamara. And thanks for hosting. Now, Rosie is asking, please, should I be worried if I'm getting severe headaches and back neck pain? So pain in the back of the neck, I guess. The sad thing is getting a GP appointment these days to get a thorough checkup to put your mind at ease. But having said that, if contraception increases your weight and of course your blood pressure, and you don't have any other option, what do you do? So Rosie's got a dilemma there. She's getting headaches, she's getting pain in the back. She's obviously acknowledging the difficulty getting appointments these days, and the fact that if you've got weight issues, blood pressure issues, and you need contraception, then where does that leave you? So quite a packed one there for you.
That's interesting. That if I'm to dissect it to the best of my ability, in view of the time constraints, there's one thing that a lot of people do not consider. The contraceptives, one of the notorious side effects is headaches. So if the headache is linked to the contraceptive, that's one thing to consider. It could well be one that needs changing, right? The other thing about the headache is that sometimes the headache depends on which one you have. So if it's continuing and you're doing your best to actually control it, i.e. taking your painkillers and you're not, then obviously, you'd always come to us, because as I say, there are red flag signs you look for in a headache. And those ones are like, when you nod, the pain is such that like the head is coming out. Not like when you have lower there where you have sinusitis, it's like the head is, so every time you nod, it's like, you get pressure symptoms in the head, yeah? Sometimes it might be a 60, 70-year-old who's got arthritis of the neck, and that can actually influence the headache. Sometimes it's just the glasses, yeah? They've not been checked for 5 years or 6 years, and so therefore now you're straining the eye muscles, and that would reflect on the headache. So there's a lot of things there that could cause the headache. So I need to actually find out what is causing that, and it's a multi-pronged approach. And as I say, it's not something I'll just tell you now, this is what is causing it. Obviously, if it's a side effect related to the contraceptive, then clearly you need to probably get the GP to change that to something that is more suitable, really. Or maybe another form of contraception, not necessarily the oral contraceptive pill, but maybe the coil, maybe, other ways. So it's something that needs to be handled. You don't have to suffer in silence. As I say, if you're not getting anywhere, well, of course, as I say, the red flag symptoms, you definitely want to go to an A&E department to get that sorted. Because if you're vomiting, your vision is impaired or it's getting bad, yeah, and the headache is not responding to the painkillers, it wakes you up, in the morning. All of these are signs, to say that this is not good. Bleeding from the nose, black eyes underneath, all of these would need to be sorted out. And you might end up with a bleed, if at all, is the blood pressure and it's not being controlled. And so therefore you probably might need a scan. So there's a lot of things that will be looked into there. And it just needs you not resting until you get what you want. Therefore, I'd say go onto that line, speak to the GP maybe at a particular time. If you can't, and the red flag signs are there, we're there to help.
I agree completely. Thank you for that, Dr. Kamara. And Rosie, I think you should try and get someone to discuss these concerns with, because as Dr. Kamara said, there's a lot in there that needs unpicking and sorting out. And I do hope that you're able to get an appointment. If you're not able to, you can. I know we're trying to desist from people using sort of emails and letters and that sort of thing. But I always say that there's always a way to get your GP, even if you can't get an appointment, and you can go to reception and say, look, this is what I'm struggling with. I need to speak to somebody, or, send in the e-consult these days is a common thing, or whatever. Try and get that help, because you don't want to rest until it's sorted. So I do wish you all the best on that. Moduper says, thanks a lot. Very interactive. I've learned a lot. We can see more answers coming in as well. and the team is monitoring the answers. Nicole, very insightful presentation, Dr. Kamara. ZG says, what is the breathing exercise machine to buy? So I'll give that to you, but I'm just going to give you another couple of questions, Dr. Kamara, as we try and round up. So Galaxy tab, there's no name. If one is taking medication for a number of years for hypertension and diabetes, how often should you be called for reviews? Thanks, Dr. Kamara, for an excellent presentation. So on that one, I would probably say that most of the time, if you're a hypertensive or a diabetic, or you've got any chronic illnesses, you will probably, at least minimum, you would probably have a once a year review. But between that, there will be times when you'll be brought forward sooner, depending on how well your condition is controlled. So if we've got a poorly controlled diabetic, we will be seeing that patient more frequently. If we've got a stable diabetic, everything is absolutely fine, then they know that they have their blood tests 6 monthly and yearly. So you will know all these things. And if you haven't been called for, then please find out what your sort of review dates are. And if you're not sure, just contact your GP. The same with hypertension. If people have new changes to medications or we've made adjustments, then we would monitor them fairly frequently until their blood pressure is well controlled or stable. But if your blood pressure is completely controlled, no change to your medications, you've been on the same meds for several years, you've not got any problems with it, then it might be that you just need to be seen probably once or twice a year. But I think one of the messages is that there's no reason for any of us not to have a blood pressure machine. You know, for about £20 or thereabout, we can get a blood pressure machine. We can keep an eye on our blood pressure and we can take control of our own health. So please, if we can, let's do that and help ourselves as well. Thank you. So the breathing machine one, Dr. Kamara, that's still with you. I'm just going to add one more.
Yes. They're a bit pricey, the breathing machine ones, but they're quite reliable. As I say, the Chinese can wax lyrical about the breathing exercises. They do help. As I say, I can bear testimony to that because I've been using that machine and it's helped me a lot with my blood pressure control. Yeah, so even if you can't use the machine, but just, you know, taking these, what they say is like they have what they call awake proning. Awake proning, that's right, yeah. So it's like you're lying on the front and you are taking this deep breathing, deep, slow breaths, and then holding that for like 10, 15 seconds, and then breathing out slowly. So you do it once, and then the next one, and then the third one. And by the time you get to the fourth one, you actually extend the time instead of it being maybe 15 seconds, maybe 20, 25, if you can hold it. And then as you're breathing out, you get this, this really proper cough. So that aerates the lungs, and that helps with the, you know, and you do that, you know, probably, I don't know how many times you can do that. It does help. There's no questions about that. But on its own, it's not the be all and end all because you have other things to add to it, remember. So if someone says, all right, okay, I lose my weight, but then I'm sedentary, well, clearly it's not going to help. So it's a combination of all of that that would help. But the breathing exercises have been known to help scientifically and otherwise. They've been proven to be useful.
Thank you. Okay. So a comment from Fiona. There are some recommended teas such as hibiscus to reduce blood pressure. Any views on this? And then again, Fiona says, how often should we realistically be checking our blood pressure, as I believe it can change so quickly? However, the NHS or GPs check it once a year. So as often as you want to, I mean, don't get too much into the habit of doing it every single day, because then it just puts your blood pressure up. But I tend to say to my patients, even if your blood pressure is stable, even if you're just checking it a couple of times a month, just to have an idea what's going on, that's fair enough. Fiona, if your medications have been changed or you've had recent fluctuations, I beg your pardon, in the blood pressure, then you might want to do it a bit more regularly, probably some readings over a week or two, so that your GP can review that. But once your blood pressure is stable and controlled, you don't need to do it every single day, because that in itself is a source of stress. So probably once or twice a month. I don't know what you would recommend, Dr. Kamara.
Yeah, as I say, you know, the thing about, I don't know, just to buttress what you're saying, because you're doing the blood pressure, there's one thing you have in mind, oh God, what's it going to be? Is it high or low? And in just doing that, the blood pressure will fluctuate. There's no questions about that. So the more you do it and the more you make, because I've got patients that come to me and say, oh, I check it every day and things like that. Well, why do you want to do that? You know, I check it every hour. Well, hang on, mate. That definitely will going to be fluctuating. There's no questions about that. So if you make it once a week or once a fortnight, you know, twice a month, That's not, but don't make it a habit of doing it on a daily basis, because all you do is you're getting yourself all stressed. And as I said, the internal stressors are there for one thing. You know, they go up, you know, because they prop it up. So if, for example, you know, somebody is not stressed and now he's saying, I'm going to go and do this now. What's it going to be? That in itself would trigger it, because the mind works, the brain sends the messages all the time. And therefore, don't get involved in that. As long as you're controlling it, as long as you know you feel okay and you're taking the medication and you're doing the necessary things, well, the blood pressure will rise with age anyway. Yeah, it does, but it has to be at a rate or at a level where it's controlled. If it becomes precipitous, i.e. where it becomes dangerous to your health, then clearly that needs to be controlled. But measuring it is not helpful on a daily basis.
Thank you for that. Thanks. And I hope that helps, Fiona. The teas, was there any comment about the teas, the hibiscus, just briefly?
I mean, it's herbs as well. Teas, fine. If you have chamomile that helps you to calm down, by all means do that. Hibiscus is a lovely flower. We know it's got medicinal properties. We used it, I remember when we were kids doing biology in Africa and things like that. Yeah, it's been known to show that. So anything that can help you to calm down, to de-stress, to unwind is a welcome bonus. It's as simple as that. But remember, not on its own. I want you to take this. This is the take-home message. No, because you've taken 5 cups or 10 cups of hibiscus tea, the blood pressure will go down. That's a falsehood. That's not true. There are this combination of things that we've just talked about. You know, the alcohol consumption, the cigarettes, you know, the stressors, you know, the weight control, the less salt, the less portion of food. All of that is what we need to actually influence or impact that blood pressure. Yes. Not just the hibiscus tea.
Yeah, and that's really important, that holistic lifestyle change is what's important. And so do join our Healthy House sessions on Tuesdays for a bit more information. I think we will have to round up the questions. I can see more questions and comments coming in. We probably need to round up now. I'll go through what we've got there, and then if you've got any further questions, or if your question wasn't answered, please send an email to health@cahn.org.uk. When I finish with the questions, I'll post the blood pressure numbers in the chat box. So just to go through the...
Sorry, I didn't interrupt. Sorry to interrupt. But doctor mentioned about cooking the rice, and he don't use salt in his house, but it is in the gravy. So if we are going to keep away from the salt, is it why should it be in the gravy to give it a bitter taste?
Oh yeah, yes. I didn't say that you shouldn't put it in the sauce. No, as I said, rice, I don't put salt in it, you know, and you go to acquire the taste. But definitely there is salt in the sauce because it's cooked salt, and obviously the ingredients and some of the condiments we use do have salt in them. So there's no need for me to increase the salt in the rice. Do you see what I mean?
Okay.
Thank you.
Thank you very much.
Okay, thank you.
Very good session.
Thank you.
Thanks for the feedback. Thank you, Dr. Kamara. Yeah. There's a question from a caller. She says, my father has low blood pressure, hypotension, and so sometimes low. Can you shed some light on this? So probably very briefly, if you can, Dr. Kamara, because I'm sorry, we do have a few others. Just briefly before you talk about that. So Rosie says, thanks. Margaret says, what's the best time to take my Amlodipine? I'm on 10 milligrams. So most people take it in the morning, but if you've been asked to take it in the evening, that's fine. It's a once a day medication. And then again, what's the name of the breathing exercise thing? So Dr. Kamara, if you've got a name to put in the chat box, then that's right. That will be fine. And also Sam says, how can I reduce my diastolic? Okay, so the same measures that we've talked about generally. And also Amy says, meditating on the word of God or the Quran or your religious books can help. So anything that really gives you that source of relaxation and hope. So the one about low blood pressure, please. Over to you, Doctor.
Yeah, but again, that's something that needs to be looked into with a more microscopic, if you like, approach, because the blood pressure could be low, but that may be normal for the person. That's important to remember that. I mean, most of the young women do have low blood pressure, and that's one of the pitfalls. So if you've got somebody who's elderly, who's on antihypertensives, and they come to me, the blood pressure that is deemed to be normal, for example, they come to me with a blood pressure of 110, what people overlook is the fact that the blood pressure could have been 170 and they've dropped it precipitously to 110. So if you say 110 is normal, then probably you need to be a bit more careful, because that low blood pressure might just be because of something happening. They may have overdosed, they may be bleeding, yeah? And all of that needs to be looked at. But if it's a normal blood pressure, which makes him carry on without feeling dizzy, without feeling out of breath, without feeling woozy, and feeling as if they're fainting, then that may well be normal for them. And therefore you need to take that as it is. But if it was very high and now dropped, that's a different thing altogether. You need to look at that. But if they are symptomatic with the low blood pressure, then obviously that needs to be looked into. Is it medication that is causing it? Is it bleeding that is causing it? Is it diarrhea? Is it dehydration? So all of that, again, needs to be looked into with a fine microscope, and that would take a lot of investigating to do in order to come up with a decision as to what the reason is. But as long as they're functioning normally, perhaps that's what it is. Some people are lucky they have low blood pressure and they are thankful for that. The likes of us who don't have that, well, obviously we need to do what we need to do to get it under control.
Thank you so much. And on that note, it's nearly 12:40, so massive apologies for the extended time, but I'm hoping that this has been a very useful session for everyone, and we've all benefited one way or the other. The draws will happen and you get to know the results of those who've won next week, so do tune in next week. But we've had a wonderful session on hypertension, and our guest today has been Dr. Mohamed Kamara, an emergency medicine consultant, and he's taken through a very wonderful session. Thank you so much, Dr. Kamara, and thank you to everyone with your comments, with your suggestions, with your contributions, your questions, those who unmuted yourselves as well. We really appreciate you, and those who joined us from not necessarily just on Zoom, but on YouTube, on Facebook, and wherever you're engaging with us from. It's been my pleasure to host you. My name is Dr. Diana Asante, a GP, and it's been my pleasure to host you. I will now hand over to Percy to do the closing. And Dr. Kamara, if you do kindly put in the information about the breathing machine and the numbers for the blood pressure in the chat box while the closing session goes on. Thanks to the team working behind the scenes. Thanks to all the partners of the CAHN Health Hour. Over to you, Percy, for the closing.
All right, thanks, Dr. Diana. Just to kick off, saying massive thanks to Dr. Kamara. That was a very brilliant session. I think in terms of delivery and the content, I think that's really top there. Part of the furniture of the house really for the program. So massive thanks to you once again. And as well, thanks to Dr. Diana, as smooth as always in terms of coordinating the program. So just say thanks to you. And also to our viewers joining in, right from all around the country and even outside as well as we saw. So really brilliant to have you. And then thanks for your contributions. Thanks for making us interactive as it was really. So just a few things, to keep us updated with. And before I go into that, I must say a big thanks to the partners as well. The program is jointly delivered by all our partners alongside CAHN. So we've got the Black Health Initiative, we've got Croydon BME, we've got Rafa Development Agency, we've got Enfit Caribbean Association, Royal Assembly, Redeemed Christian Church of God as well. They're all doing superb work when it comes to health literacy, and then trying to impute information to community members, really things that will help us in terms of how we consider our health and obviously how we take care of ourselves and improve the health outcomes generally for our community members. So please, their contact details are up there. So as much as you can, please do reach out to them, try and get more interactions with what they're doing across their footprint, and then that'll be very useful to yourselves as well. Then just down to the events we've got coming up. Rafael, like I just mentioned, one of our partners in Birmingham. Currently, they're having a health literacy program called Healthy Living and Lifestyles event. It's on now at the CAP Center down in Birmingham. So, if you know someone in and around there that would benefit from it, please do give them a call and ask them to join in. It promises to be a proper mix of health knowledge as well as fun and things that you could catch up with. So please do that. Then for next week as well, we have another interesting health hour session coming up. It will be on breast cancer. We all know the buzz around it and how it impacts our women now. So please do tune in. In terms of delivery, there's a twist to it because it comes along with a lived experience story as well. So please try and get involved with that. Then following on from that, on Tuesday, as always, we'll be having our Healthy Heart session. It will be on fiber intake and optimal health. So please do endeavor to join that. And then in terms of going forward, so we've got a very big event coming up later on this week on Wednesday. It's the Civic launch event for the Black History Month. CAHN will be hosting that in Manchester Cathedral. It's going to be a very brilliant event because we've got things like dancers, singers, speeches from top leaders and all that, just to showcase our Black culture really, and then what Black History Month means for us as we build up to October. And then following on to that, into the Black History Month proper, we will have our gala. I mean, it's just celebrating CAHN 50th anniversary. It's going to be a big one. It's going to be a fundraising. There's going to be award ceremony where we try to recognize key people that have done great stuff, I mean, over the past couple of years for the community as well, in terms of service as well to the community. I mean, it's available for us. The link will be there. Please do endeavor to come in. There are tickets available. Try and contribute as much as you can to it, and we look forward to seeing yourselves. Then the other bit I want us to be informed about for the award, like I just mentioned, the nomination is open to the public. So as much as you can, please nominate people that you know that have done great stuff. I mean, for the community, it could be anyone, you know, it could be an organization. There are about 14 categories up for nomination. So please do endeavor to use the link provided to nominate as many people as you can, really. And I'm sure my colleagues now, they'll be putting up a video that just tells us more about the gala. So just say massive thanks for joining the program, and do enjoy the rest of your weekend.
Greetings, Natalie Stewart, the florist is here. And I'm here to tell you about an amazing night that you should not miss. The Caribbean and African Health Network has a vision, and that is to end health inequities for Caribbean and African people. Such vital work needs to happen, and to help achieve this, the Caribbean and African Health Network has organized another high-end Black History Month Awards Gala at the 5-star Hilton Hotel in Manchester. It's gonna have you wined and dined and entertained all evening. From red carpets, limousines arrival. Don't forget to book your table before the 18th of September to be in with a chance to win. To hearing myself, the florist, performing as you arrive for that champagne reception. Yeah, I'll be performing for you throughout the evening, and you will have an opportunity to meet and greet and take photos with you. So, do you want to recognize an individual for their great work and support of others? Or do you have an organization you want to nominate for their contribution to tackling inequities? Then nominate them now. Do not miss this event. Remember, we are fundraising for a cause. Tickets are on sale right now. For access to all of the above, please visit www.cahn.org.uk. I'll see you there. God bless.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members, such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, Share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our Health Hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.